Cavities develop quietly. Pain comes later, sharp like an electric shock. But here's a fact. According to the WHO, cavities affect the vast majority of adults. At the same time, diet plays a key role in maintaining oral health, and many problems can be prevented even before symptoms appear. I am Dr. Maria Nikolskaya, a therapist and nutritionist. Over years of practice, I've noticed a pattern. People are willing to spend money on whitening and fillings, but rarely think about how daily diet affects the condition of their teeth and gums. It's important to understand. Teeth and gums are not just stone structures. Living tissue with blood vessels and nerves is hidden beneath the enamel. Gums constantly regenerate, and enamel is capable of remineralization, partial restoration of its mineral composition, and both processes depend on what we eat. When a patient comes to me with bleeding gums, I don't just look at their mouth. I ask about their diet over the past few weeks. Often, it's dominated by soft foods, with few vegetables and many processed products. Yet, hard vegetables and fruits stimulate saliva production, the natural protector of enamel. Saliva is not just liquid. It contains minerals, enzymes, and antibacterial substances. When you chew an apple or a carrot, saliva is actively secreted and helps neutralize acid, wash away food debris, and deliver calcium and phosphorus to the enamel. Soft foods do not provide this effect. Now, let's talk about the nutrients that support oral health. Calcium and phosphorus are the main minerals in enamel, but dairy products alone are not enough. Vitamin D is critically important for calcium absorption. Without it, even a calcium-rich diet will not be beneficial. Vitamin D is found in fatty fish, egg yolks, and is also produced by the skin in the sun. Vitamin K2 helps direct calcium to bones and teeth, not to blood vessels. It is found in fermented foods, kefir, hard cheeses, and natto. Vitamin C is involved in the synthesis of collagen, a protein that forms the framework of the gums. Its deficiency can manifest as bleeding. Sources: fresh vegetables and fruits, peppers, broccoli, citrus fruits, kiwi. Important, vitamin C in packaged juices breaks down quickly. It's better to get it from whole foods. Magnesium works in tandem with calcium, improving its absorption. It is found in nuts, seeds, and whole grains. The information in this video is for educational purposes only. I do not provide medical advice or encourage you to skip dental visits. Any dietary changes or supplement intake should be discussed with your doctor, especially if you have chronic conditions. Now, what really works in everyday life? First, add hard fruits and vegetables to your diet: carrots, apples, celery. They gently clean the tooth surface and stimulate saliva production. This is not a substitute for brushing, but natural support between meals. Second, include sources of calcium: dairy products, cottage cheese, as well as sesame seeds, almonds, and leafy greens for those who avoid lactose. Third, watch the acidity of your drinks. Juices, soda, and energy drinks contain acids that temporarily soften enamel. If you drink juice, do so in one sitting, not over an hour. Afterward, rinse your mouth with water. And don't brush your teeth immediately. Wait 20 to 30 minutes for the enamel to regain its hardness. Fourth, don't forget about dental floss. A toothbrush cleans only 60% of the tooth surface. Food debris between teeth is a breeding ground for bacteria. Flossing before bed is a simple yet effective habit. Regarding supplements, they can be beneficial for vitamin D or calcium deficiency, but only after consulting a doctor. Taking high doses independently can be harmful. Avoid common mistakes. Brushing your teeth immediately after acidic foods. You can damage softened enamel. Hard brushes and aggressive movements wear away enamel. Whitening toothpastes daily. They are often too abrasive. Folk methods like vinegar or activated charcoal can harm enamel. You can notice quick improvements in just 1 to 2 weeks. Gums become less inflamed, bleeding reduces. But strengthening enamel is a gradual process. It requires months of regular support through diet and hygiene. Remember, diet does not replace treatment for cavities or periodontitis. If there is pain, a hole, or swelling, a visit to the dentist is necessary. But a proper diet can become a powerful ally in prevention and maintaining treatment results. A simple daily plan. Morning, dairy product plus hard fruit, cottage cheese with berries, yogurt with apple. Lunch, vegetables, a source of protein, if possible, fish. Afternoon snack, raw carrot or celery. Evening, brushing teeth, flossing, rinsing with water. After eating, rinse your mouth with water, even at work. Small habits add up to results. You won't build healthy teeth in a day, but in a few months of a conscious approach to diet and hygiene, you can significantly strengthen your oral cavity's protective resources. And remember, the best filling is your own natural tooth, and the best protection is daily care, not emergency help. Take care of yourself and see you in the next video.